Well, welcome to another episode of the Beauty and the Beast podcast. I'm Sam Jejurikar, a plastic surgeon in Dallas, Texas. And as always, I'm joined by my good friend and co-host, Salvatore Pacella, plastic surgeon and the head of the Strips Clinic in both La Jolla and in San Diego. Good to see you as always, Sal.
Thank you, sir.
Today, we're going to talk about mommy makeovers, which is a term that is just everywhere in the plastic surgery world, but I still find it to be a very misunderstood thing. So many times patients will come in and they'll say, well, what exactly is a mommy makeover? How do you respond to that question?
So I would say, it's a great question, right? It is anytime you combine a breast surgery and a tummy surgery, that's a mommy makeover. Because if you think about it, that's the part of your body that's affected when you become a mommy, right? So now that could mean in the breast, it could mean doing a breast augmentation. It can mean doing a breast lift, a combination of either of those. It can be fat transfer.
Even a breast reduction.
Even a breast reduction, absolutely. In the tummy, that could also be a couple of things. It could be liposuction to the flanks, the sides of the abdomen, the center of the abdomen, and it can be everything from that to a full-fledged tummy tuck. And I think, I think Sam will agree with me. This is a wonderful combination. I think, both of us being experienced surgeons in our respective cities, I think throughout the years we have gained a lot of efficiency in the way we operate. And I think, when we started training, sometimes it was a little de-emphasized to do these two operations together because of the length of the operation, potentially. Some breast surgeries may take anywhere from 2 to 3 hours. The abdomen may take anywhere from 2 to 3 hours as well. And that's about 5 to 6 hours of surgery. But I think the more reps you do, the more patients you take care of, you can do that in an efficient fashion. So, and I think I've found, throughout the years, this combination is effective. You get economies of scale with recovery, and it can be done efficiently.
Yeah.
Your thoughts?
Efficiency is important, and obviously we should spend a minute talking about safety because these are longer body contouring operations that can range from anywhere from 4 to 6 hours. Most of us have a cutoff at 6 hours because we think the risks get too great. But you need to worry about things like blood clots, for instance. So really sort of focusing with the patients ahead of time to make sure that they're walking and moving around is really important. Making sure that they're staying warm during surgery, making sure that that they really understand everything that's going into it. You can do it efficiently, you can do it safely, and you can really, you can really do a lot for the patient. So let's dive into what it actually is. The first, I think, the one thing that every mommy makeover has in common is a tummy tuck. Would you agree with that? I feel like a tummy tuck is the one aspect that's there. So who's a good candidate for a tummy tuck? What do you tell a patient about a tummy tuck? What do they need to know in terms of like what to expect from a recovery standpoint?
Right. So I think you got to go back to what happens in the changes in pregnancy, right? One of the things patients come in to talk to me about when they're looking at tummy tucks is they're maybe sent from their primary care physician and they said, well, my muscles have separated after pregnancy. This happens not infrequently in multiple gestation twin pregnancies, right? And patients will sit up. You can see a little bulge there. But the interesting thing is that's not just the only problem. It's not a separation of the muscle. It's a global stretching of the muscles, right? So whereas the six-pack muscles, they may be this size before pregnancy, when you add in the separation and then you add in the stretching, it's really globally the abdomen has been deconditioned. And so what I tell patients is there's no way of tightening this up without doing some surgery. And when you do that, you want to tighten up those muscles so the tummy and the abdomen, the abdominal wall musculature can be nice and snug. And the benefit of that is patients love it. They stand up straighter. They are able to do exercises they haven't done before. There's not this tension in their body that they're always kind of trying to suck this in. The important thing to understand is most of the time, you can't tighten up those muscles without taking out some skin too.
Yeah. And I think, I think the thing that's really changed a lot in tummy tucks, among other things, is how we tighten muscles. It used to be that there was just sort of one vector that you would tighten muscles. And it's this concept of diastasis or separation, which most patients have some degree of, even with one pregnancy. But they would just try to tighten the patient up and down in one direction. And what happens is the rectus abdominis muscles, which are the paired midline muscles, start to infold. So you'll take an athletic patient and they lose their ability to see a six pack, and you only tighten them in one vector. Now there's a concept of multi-directional muscle tightening where you address specifically what you're talking about, where that generalized stretching you can attack by tightening perpendicular to the line of stretch. Some patients who have profound, just generalized laxity of the muscles, I'll create a corset coming across in this direction, which shortens the muscle, also preserves their tendinous inscription so they can see their six pack muscles. Over the obliques, we'll do the same thing, which will pull in their waist quite a bit. I think the other concept that's worth touching on are terms like mini tummy tuck, extended tummy tuck, traditional tummy tuck. What do those mean? And what is a mini tummy tuck, Sal?
So I can tell you how I define a mini tummy tuck,
Yeah.
and then you can tell me yours. So I would say that to me, a mini tummy tuck is combining liposuction, removal of skin, without changing the position of the belly button. Okay. And that is preserved, I think, for patients who have very minimal stretch in their abdominal wall, and have just a little overhang after pregnancy. And maybe it's because the C-section scar has indented a bit. And so that's an easy recovery. The liposuction's done easily. The scar heals very nicely. You've got a different definition of mini tummy tuck, don't you?
It's not my definition. And just to be clear, the scar tends to be a little shorter with a mini tummy
Correct.
tuck too.
That's correct.
There's a surgeon who I won't say his or her name, but kept posting a bunch of mini or tiny. It was called a tiny tuck, and finally it was unveiled to me that the tiny tuck was actually just a regular tummy tuck and a tiny patient. So we always check that in the screen you could never see the incision. So I'm like, wow, those are amazing mini tummy tuck results. What about an extended? What's an extended tummy tuck? Because I do find there's a huge variation among plastic surgeons about what they mean by an extended, and it means something very different in my practice than I think in most patients, most surgeons' practice.
Yeah, I think extended tummy tucks are almost always in patients that have had some sort of massive weight loss. And that's where extra skin is located along the hips and flanks, and above kind of the underwear line, if you will. So whereas in a traditional tummy tuck, we may just go to the hip bone to sew the patient up, to put the incision. In an extended tummy tuck, I find myself going a little bit more far laterally or around to the back. Now, this is different than what would be called a circumferential body lift or a 360-degree tummy tuck, right? That you have to change patient's position. They often have times extra skin on the lower back. How about in your practice?
So yeah, it's a little different in my practice. I agree with the definition. To me, an extended tummy tuck usually starts about midway along the central axis of the buttock. So it requires a position change. The incision wraps around the side. It's not really necessarily reserved for massive weight loss patients. There are certain patients that come to me and want an hourglass silhouette. So when patients say, I want to look like an hourglass, to me, that's an approach where we do what's called lipo 360, or a 360-degree circumferential approach of liposuction to the patient, where we use a subunit approach. We leave the buttocks and the hips alone, and we aggressively suction above that. Then we'll do an extended tummy tuck, so we're really removing the redundancy along the sides. And that's how you can really create a really nice hourglass shape. And if they want an exaggerated hourglass, we might add some fat to the hips. So I'd say in my patients, it's probably 50-50, whether they get a traditional or an extended tummy tuck. But I think in many ways, there's some selection bias, right? Surgeons tend to create a certain look. Patients like them. Then they post those looks. And then more and more people who want that look come to the surgeon. And so I think that's part of just sort of what I do. And so it's not necessarily reserved for that.
And does adding the breast surgery complicate things for you?
I think, as you alluded to earlier, we're so efficient in how we do this that no, we commonly will do that. An extended tummy tuck is an operation that we typically say takes about 3.5 hours in combination with lipo 360. So then we can still do a breast lift or a breast augmentation. And that's or even a breast augmentation with a lift.
And what do patients say about the recovery of adding a tummy to a breast surgery or vice versa?
Well, or what I tell the patients, I'm not sure what they say, but I'll tell you what I tell them based on what I see is what I'll typically see about the recovery is that the tummy is the thing that dictates your recovery. When you do a tummy tuck, whether it's an extended or a traditional, that muscle tightening component is what creates your recovery. I tell them it's about a week that they need help taking care of themselves and their family. About 2 weeks before they're going to be able to resume taking care of their kids. And then between that period of time, between 2 and 6 weeks, are able to do more and more. It's an emotionally challenging time because they get fatigued very easily and they get, they get swollen. But by about 6 weeks, everybody feels pretty good.
So a common question I get from patients many times is, Doc, when I have my tummy tuck, how much weight am I going to lose from that?
Yeah.
How do you answer that question?
Very little. It's a shape-changing operation, not a weight loss operation. Common question I get asked is, can I just exercise my way back to my pre-baby body?
Very challenging. The analogy I like to use is this is like a bungee cord getting stretched out. After a while, after it's stretched, it just becomes a rope. And the way you tighten it up is you shorten that rope, right? And so that's what happens with these muscles. Like as a lot of patients tell me, children, they destroy our bodies and ruin our lives. Does your wife tell you that?
No, she actually loves her children.
I'm joking. Love the kids.
Yeah.
So,
now, and then one more question. Patients will say, look, I want that shape, but I just don't want the scars. Is there a way to do this without the scars, Dr. Pacella?
I think it's a challenge, right? I think there are operations where patients have very tight skin and maybe a little bit of laxity of their abdominal wall muscles.
Mm-hmm.
And, a few times in my practice, I've done sort of a hybrid endoscopic abdominoplasty, if you will. So we make a little cut just above the underwear line, and we may put in a camera and use some special devices to tighten up the muscles around the belly button. In those, we remove very little, if any, skin.
Yeah, and I've done that. Haven't loved my results as much because the skin doesn't redrape. I'll tell patients, look, you need scars. I can't do anything about the need for the scars to create the shape that you want. We can do a lot about the location, and we can do a lot about the quality, both in terms of how we close it and how we care for it. I think we've covered, what we really need to on this topic. Any last second thoughts you want to add?
I think, in mommy makeovers, I think one of the values and the benefits are, unlike facial surgery, you can hide these scars in the tiniest of bikinis and not even see them.
Mm.
And I think that's an important concept for patients to understand. Don't be discouraged about the scar. It can be hidden.
Yeah. Cheers to that.